I'm John Houston, and I am the CEO and founder of Dualams. I've always been kind of a closet inventor, just never had the right market. I started noticing I was losing my voice around 2000. During that time, I probably had 55 or 60 exams in my airway. And it's a challenge for the patient. It's a challenge for the doctor too. Dr. Simpson and I have been working on a clinical trial that we could make that post-surgical procedure or pre-surgical procedure more effective. And not just for the patient, but also for the doctor. And I knew my science fair project would not hold up to the rigors of a clinical trial. Real-time, we can bring this to market.
John came to our office and described the device that he was envisioning, and our job was to engineer it into a real production device that would help the patient experience during the exam process.
The innovation is in the nebulization of the lidocaine. That's what affects the patient's ease of use. So for me, it was just creating a platform for that to work seamlessly. When John Houston came to us and asked us to develop the project further, I was really inspired by the idea of getting to help patients who are having a really hard time with this specific procedure and really getting to change how they would experience something that in some cases could drastically affect their lives.
The biggest problem with procedures that we perform on these patients is their lack of tolerance of it. When we administer a local anesthetic to anesthetize the larynx, the problem with most patients is they cough and choke and poorly tolerate this procedure, to the point, in fact, I have many patients that have told me they avoid coming in to see me because of the side effects from the numbing process. And so what we were seeking to do is come up with a more readily tolerated numbing process, one that so far did not exist. I've had the opportunity over the past probably several months to use this system in a clinical trial, so it's being rigorously looked at in a scientific way. And I can say without a doubt it's been a success. The patients have tolerated the procedure well. They've been adequately anesthetized to be able to tolerate the procedures. If I were to describe the new process that John has developed, I would say salvation.